Welcome to Human Health Lab, where science meets movement, nutrition, and mindset. Your journey to better health starts here. Two patients, one diagnosis, hypertension. Alex takes only medication. Maryam uses meds plus a supervised exercise program. After a year, Maryam's resting blood pressure is lower. Her fitness is higher and her risk factors look better. Today, I'll show you how much difference exercise makes, the mechanisms, safety rules, and exact training plan you can follow, step by step. Hypertension means blood pressure that's chronically too high. Most global bodies define it as more than 140/90 millimeter per mercury in the clinic. US uses more than 130/80 millimeter per mercury as a stage 1. Your doctor will classify you based on the system they use and confirm with accurate office and home readings. Hypertension is massive. Roughly 1.28 to 1.4 billion adults live with high blood pressure worldwide, and many don't know it or aren't controlled. Why does exercise work? Aerobic and resistance training lower vascular resistance, improve endothelial function, and reduce sympathetic and renin-angiotensin activity. Training also improves arterial compliance and body composition. Together, these push blood pressure down. Here's what adding a structured exercise to usual care typically delivers, based on meta-analysis and guideline summaries. About -8.3 to -5.2 millimeter per mercury on average. Meaningful reductions. Meta-analysis show SBP and DBP both decrease in hypertensive adults. Strong average effects on resting blood pressure. Large syntheses show notable SBP over DBP drops. Endurance training lowers daytime SBP and DBP. Regular training raises CRF by circa 10% or more over month. Higher CRF is equal to lower CV risk. Versus medication alone, meds plus a real exercise program typically give you 5 to 10 millimeter per mercury extra systolic reduction and 2 to 5 millimeter per mercury diastolic, plus better fitness and day-to-day BP profiles, if you actually do it most days. Before training, we screen and personalize. Confirm BP correctly and use HBPM, ABPM when needed to detect masks or white coat patterns. Pre-session blood pressure rule of thumb. Don't start a structured exercise if resting blood pressure is more than 200/110 millimeter per mercury during exercise. Consider stopping around more than 250/115 millimeter per mercury. Or with red flag symptoms like chest pain, neurosigns, pre-syncope, or a more than 10 millimeter per mercury drop in SBP with symptoms. Consider clinician-guided stress testing and gradual progression. Hydrate, monitor blood pressure and volume. Avoid extreme heat. Food care, avoid hypoglycemia. Avoid heavy Valsalva and very high strain. Pick modes that respect osteoarthritis or back pain. Cycling, walking, water-based options are fine. Day-to-day, light blood pressure at home. Same arm, seated, 5-minute rest. Spread sessions across the week and avoid breath holding. Know how common blood pressure meds change your training. Blunt heart rate responses. Use RPE and talk test instead of pure heart rate zones. Often helpful for anxiety and angina.
How's that effort level feeling?
I can still talk, but as you can hear, I'm working hard.
Risk dehydration and electrolyte loss, cramps, arrhythmia. Hydrate, monitor potassium when indicated. Effective with training. Watch for post-exercise hypotension, cool down, stand up slowly. Higher likelihood of post-exercise lightheadedness, extended cool down, gradual transitions. Here's the plan I want Maryam on, then we individualize. 5 to 7 days per week, accumulate 150 to 300 minutes per week, moderate, brisk walking, cycling, swimming. Post-exercise hypotension lasts up to 24 hours, so most days is ideal. Consider HIIT 1 to 3 times per week if cleared. 2 to 3 days per week, 8 to 10 exercises, 2 to 4 sets of 8 to 12 reps, major muscle groups. Avoid Valsalva, breath steadily. Hand grip or wall sits 3 times per week. Evidence shows a strong blood pressure reductions. Integrate progressively and monitor symptoms. 2 to 3 times per week for mobility and fall risk reduction. Stand or walk 1 to 3 minutes every 30 to 60 minutes to help vascular function. Expect 5 to 10 mm per mercury systolic and 2 to 5 mm per mercury diastolic average reductions with adherence. Hypertensive groups often see the biggest gains. Warm up 5 to 10 minutes, easy walk and cycle, plus mobility. Main aerobic 20 to 40 minutes, RPE 5 to 7 out of 10. You can talk in short sentence. For HIIT, for example, 4 bouts of 4-minute hard, 3-minute easy, or 6 bouts of 2-minute hard, 2-minute easy, after 2 to 3 weeks of base. Resistance, 25 to 35 minutes, 6 to 10 moves, squat, hinge, push, pull, row, and core. Start moderate, add load or reps weekly. Isometric option, 2 to 3 sets, hand grip, 2 minutes per hand, add 30% MVC with 1 to 2 minute rest, wall sit, 20 to 45 seconds hold, build over weeks. Cool down, 5 to 10 minutes, slow walk plus breathing, never stop suddenly. Avoid post-exercise dips. Hypertension management works best when you stack small wins. HBPM routine, seated, back supported, 5-minute rest, same time daily. Tracking in a simple log. Move after meals. A 10 to 15-minute walk can improve post-meal hemodynamics. Hydrate, especially if you're on diuretics or training heat. Breathe through lifts, no breath holding. Progress 1 variable per week. Time, frequency, or intensity. And respect symptom flags. Post-exercise hypotension. After a single session, blood pressure can drop 5 to 7 mm per mercury for up to 24 hours. This is why most days matters. Ambulatory blood pressure matters. Training reduces daytime blood pressure even when clinic numbers look similar. Isometrics are powerful add-ons, but start with aerobic plus dynamic resistance. If you have hypertension, ask your doctor for a formal referral to an exercise physiologist. I've linked a referral form and a weekly training log you can print. Save this video, follow the plan for 12 weeks, and share your before and after blood pressure with me in the comments. If you're passionate about science-based tips on health, fitness and nutrition, hit that subscribe button and join the Human Health Lab family. New videos every week. Stay strong, stay healthy.